Okay, I screwed it up so you don't have to. USMLE quiz. You have a neonate that has meningitis. What bug are you thinking about? Group B strep. What are you going to see on culture? Gray colonies. What kind of hemolysis? It's going to be beta, which is a narrow, clear area. They can write it a million different ways. Okay. What in the body regulates iron, is made by the liver, and secreted by the hepatic parenchymal cells? Hepcidin. Okay. Somebody has a dandy walker. What is that? It's hypoplasia of what? It's the cerebellum and the fourth ventricle. Not the question. The question is, where does that shit come from, like embryologically? I'm talking like prosin, metin, myelin, all that stuff. It's the metencephalon. Okay. All right. Let's see. Okay. For schizophrenia, there's positive symptoms. There's three of them. What are the three? Delusions, hallucinations, and disorganized speech. Disorganized speech always gets me because it doesn't feel like so crazy. I know it's crazy, it just doesn't feel so crazy. My prerogative. You need active symptoms for 1 month. You need at least two symptoms, at least one of them being positive. The other can be negative, disorganized or catatonic behavior, diminished functioning, blunted affect, apathy, social withdrawal, yada, yada, yada. This next one gets me every time. I don't know why. I just don't accept it. This is an obstructive versus restrictive lung disease thing. Okay. You know how they're pretty similar or pretty opposite? Which one has very, very, very decreased FEV1 ratio? Obstructive. Okay. All the air is trapped in there, and that's FEV1 is forced expiratory volume in 1 second. One Mississippi. Okay. What are some obstructive lung diseases? Emphysema, chronic bronchitis, asthma, bronchiectasis, and then cystic fibrosis, which I don't like that. I don't know why I don't. It feels like restrictive and it's not. Okay. Your restrictive are going to be your pulmonary fibrosis, sarcoidosis, a little mesothelioma. Okay. Kiddos got absent seizures. What do you give them? Ethosuximide. But how does it work? It blocks what kind of channels? Calcium. But what kind of calcium channels? T type. You can also do second line valproic acid, which is going to block voltage gated sodium channels and increase GABA. Okay. How do you know if you're looking histologically at, you're looking at Candida, but you don't know if it's like albicans or another one? What does albicans have that the other ones don't? It's like the pseudo hyphae. To me, it looks kind of like a sperm, like it's coming out from the circular part. It's called pseudohyphae, and only albicans has that. Okay. You have a guy who comes in with a headache, and they scan him, and he has a tumor, and it crosses the midline. What is the most common adult onset brain tumor? That's glioblastoma. Is it benign or pretty aggressive? It's super aggressive. Usually these patients pass away within 12 months of diagnosis, and you can see pseudo palisading on histology. Okay. Another one that's so simple that I always find a way to screw it up. I mean, who wouldn't? Prader-Willi. I can find my way in Prader-Willi and out of Prader-Willi, but for some reason they ask me something that's twisty, and I just get a little lost. Okay. So I don't like genetics. I'm manifesting. I'm amazing at genetics. Okay. So it's a loss of chromosome what? 15 on the maternal or paternal? It's paternal. Okay. So it's a segmental gene deletion. And then this is the part that drives me crazy. Maternal uniparental disomy, which means two copies from mom, and then an imprinting error, normal maternal silenced. I don't like any of that stuff. Okay. Just don't chromosome 15. But I always remember like Prader-Willi is a father thing, and then Angelman syndrome is like a mother thing, and they're both on chromosome 15. Okay. Spironolactone is a what antagonist? What does it antagonize? Aldosterone. And what does aldosterone normally do? It's going to keep sodium and kick out potassium. Okay. In normal aging, how do the lungs and the chest wall change? Does the chest wall become more compliant, less compliant, and do the lungs become more compliant, less compliant? Okay, so after aging, you get increased lung compliance, but really, really decreased chest wall compliance, like extra more than the increase in lung compliance. So your total respiratory compliance is going to be down. Sorry about my dog. What drug are you going to give to someone who wants to quit smoking that binds to alpha and beta 2 nicotine receptor? Varenicline. They'll have less desire to smoke, less withdrawal symptoms. Let's see. Okay, and I did a deep dive forever ago because I wanted to know what INR was, like the lab reading INR, and I did not understand what the hell INR was. And the best way I could explain it, in case you give a shit, this is the last one if you don't scroll. For INR, it's showing your PT time, but in a universal way. So the way that I could explain it is you have Fahrenheit, Celsius, and Kelvin, right? So imagine somebody has a fever. It's going to be different on each scale. But what INR is it's going to look at each one. So if you're on Fahrenheit, it's going to say, oh, 100.8 or whatever more is a fever. It's not going to tell you, it's not going to give you a number. It's just going to say fever, not fever. And it's going to do the same thing in Celsius. Say fever, not fever. And then obviously Kelvin's like a crazy scale, but it'll say fever, not fever. So that if you're in another place with a different lab, they're just going to say this person is within range or not. That's it. But I literally went on the deepest dive because I was like, I don't understand what this means.